Next question is about bladder infections. Are there tips to avoid getting bladder infections?
So yeah, I mean, a couple things. Avoiding long periods of time before you empty your bladder is helpful. So that just creates the urine basically sitting there, increases risk of infection. It's not uncommon to see increased urinary tract infections after having intercourse. So in women, the vagina and the urethra, which is the opening of the bladder, are pretty close in space. And so post-intercourse, you can see some of the normal, flora and bacteria that are around vaginally actually be more exposed to that bladder opening. So it's not uncommon to see increased urinary tract infections after intercourse. Good strategies there are getting up or emptying your bladder immediately after. It's also important just, especially for younger patients too, just cotton underwear, letting air get to the area. So yeah, if there's any concern, about how to prevent them, there's medications we use sometimes with antibiotics after intercourse. But yeah, hydration is really important. And then again, not uncommonly as gynecologists, we'll talk about getting UTIs after intercourse and how to manage that.
Great. So to reiterate, hydration,
Yes.
emptying the bladder before and after?
Before and after, ideally.
Okay. And cotton underwear you said was ideal. So I want to ask about panty liners. Do those affect?
So panty liners and pads in general are okay as long as we're not trapping moisture and wetness chronically up against that. So, kind of like a baby's bottom will get, if anyone that's ever changed a diaper and, if there's moisture up against the baby's bottom, that's not good for their skin. You can get irritation. It's the same with pads. So whether we're using them for urinary leakage or for periods, as long as we're changing them frequently enough that we're not exposing, the urethra opening or the vaginal opening to chronic moisture, that's a good way to reduce risk of both urinary tract infections and vaginal infections as well.